Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Kocharhook. Welcome back to this conversation about the unhoused situation here in Santa Clara County. With me again are Catherine Kaminsky from the Santa Clara County Office of
Supportive housing.
Supportive Housing. Yes, thank you. And Chad, I'm not going to do it again, so I'm going to have you say your last name again because I know I'll mess it up.
Bojorquez.
Chad Bojorquez, who's with Destination Home. You're a Chief Program Officer at Destination Home. So last time we were here, we were talking a lot about just the general construct of what the scenario is and the population and the demographics and the fact that we've got some really workable scenarios and things like that. But I think there's still a massive misunderstanding on the part of most people as to what constitutes the makeup of why someone is homeless. They think that someone is there deliberately. They think, they see the people. I mean, in my neighborhood, there's a guy who collects all kinds of stuff and he has it over by, you know, the road and everything, and they think that's what people think is really going on with folks who are in an unhoused situation. And I've come to understand, by virtue of interacting with folks like you, that this is not the case. So can we talk about that a little bit and really try to get a little better understanding about what is really the truth there and why people are in this situation? Who wants to start, Catherine?
I'll start. Yeah, so thank you for, I think this is just such an important question to talk about. We know that homelessness is a housing problem. We know that the root causes here are a lack of affordable housing and income inequities. So if somebody doesn't make enough money to live in the community, to afford an apartment here, they're going to be at risk of homelessness or potentially homeless. And I think, you know, for example, for every 100 households that's extremely low income, that's households that make 30% or less of the area median income.
Which is?
Oh gosh, I don't know it off the top
It's
of my
approximately
head.
like 104,000 for a family of 4.
Okay.
Is the area median. So folks that make 30% of the area median income, for every 100 households that are at that income level, there's only 30 affordable and available units in our community. Another, I think, example that makes this really tangible is for an average 2-bedroom apartment in San Jose, a person or household needs to make $58 an hour. Or $120,000 a year,
which is
to afford the average 2-bedroom household.
Which is not likely for in a lot of jobs. You know,
thousands of folks.
When you mentioned that, it made me start thinking about, because I've lived in the Bay Area. I moved to California in '73 when I got out of college. I came down from Seattle, you know, and it was in the you know, the 80s, the 90s, and into the early 2000s that all of the technology aspects in Silicon Valley really exploded. And so there was this massive influx by the technology companies of bringing talent into the area. But the amount of housing that was here at the time for this massive influx, and then people were making really good money, so I can see how a lot of people would have gotten displaced because the landlord's going to say, I can get 3 times the amount of money over here because this guy's working at Google, I'm going to do this, right? So that had to be part of the initial impetus for the challenge, and we haven't been able to maintain the growth of housing that people who are not making $250,000 a year can afford. And when you look at that population, it's huge. I mean, it's like most people, when you go and eat at a restaurant, the chef, the cook in the back, or the person that's cleaning the table isn't making $150,000, $250,000 a year doing what they're doing, and yet they're there. Right? I've had the opportunity to talk to people who are in community services like firemen and police officers, and they live over in like Tracy or places like that, and they serve here in Sunnyvale or Cupertino because they can't afford to buy a home here. They can't afford to live here. So, yeah, it's a big problem. So
Yeah.
how do we address this problem?
Well, I think one of the solutions is developing more affordable housing. We frankly have to accelerate the development of housing, all housing, but particularly housing that's affordable at some of the lowest income levels. We can also, we know that housing programs and vouchers work, so those are also a part of the solution. I think we can build on some of the things that we know, but I think at the root of it really is that accelerating the development of affordable housing to better meet the need.
So when we build affordable housing, and I've had a chance to see some of the locations, been to some locations, and there's some
good.
stuff here we're going to talk about. I'll have them pull up some slides in a minute. But when they build a facility, like let's pull up slide 15. This is in San Jose at Lay and Southwest Expressway, which I used to live like 3 blocks from there. And beautiful complex. Who owns the complex? Is this like something that's owned by the county? Is it owned by the city? Who? When they build these beautiful locations, there's another one in Milpitas, I guess it is. I think that's number 12 there. Who owns the facility?
It does vary for different types of affordable housing. So we're fortunate here in Santa Clara County in 2016. We passed the Measure A affordable housing bond. The county in my office sort of manages that bond, which was just shy of $1 billion,
50 million, I think.
50 million. That is right now in 50 projects that are either in development, are completed in development, or in the pipeline. For most of those types of projects, the county often owns the land, or maybe leases it to the developer. Sometimes the developer owns the land, and often it's a nonprofit developer that is owns and operates the site. But we have service providers on site. There's usually housing vouchers from the housing authority that are utilized by the tenants there. It's really a multi-funders and participants to make those deals happen. Often the city is putting in funding or in a form of affordable housing loans to make those projects happen. State tax credits. So it's a complex system that, I'll be frank, it's not my area of expertise. It's other folks in my office. But I think the point is that it is a system solution that we bring a lot of folks together to solve. But that affordable housing bond is not nearly enough. I think we need more housing development to scale on multiple levels.
Right.
But it's made a significant difference. We have over 5,000 units at some stage of development, which is we're seeing the impacts every day.
That's fantastic.
Yeah.
The other thing that I think is important to articulate here is when some of these facilities are built. Look at put up number 14. I think this one was on Alum Rock Avenue. Okay, this is when you look at when some of the facilities are built in an area where it's a combination business, homes, something like that, that the net impact on the positive experience of the people in the community is significant. And there's a lot of misinformation about that. There's a lot of challenge that is put out. I think we were talking about this during before the show of there's an initiative here in is it Santa Clara, I guess, on where is it, Lawrence Expressway and Benton Avenue, right there, where they're planning on doing something, and some members in the community are just like, they're freaked out. But the actual experience of other communities when a facility is put in place and people that no longer have to live on the street in that community because they've got a place to live is amazing. It changes the whole environment in a positive way. Yeah?
Yeah, I mean, you're looking at Quetzal Gardens, which is a beautiful new building, this is diagonally across from the Mexican Heritage Plaza, which is another beautiful building, and so you're starting to see the neighborhood just be aesthetically more pleasing. There's a transit corridor here that's been revised. What used to be here was a lot of empty businesses. These are brand new apartments that are affordable in this neighborhood that desperately needs it. On the ground floor, there's a credit union. There's the headquarters for a very trusted and awesome nonprofit community-based organization called Somos Mayfair. So you're just seeing like a lot of positive energy, as you mentioned, brand new homes for people to live in, and a community starting to form. And so these have been very net positives. There's a lot of perceptions about who's going to live there. There's a lot of families, for example, with children that live at Quetzal Gardens. It'll be similar in Santa Clara. We hope, if everything is approved. Those are units for families with children. So
that's an important one, because a lot of people would think, oh, well, they don't. Who? And that's maybe part of the information that didn't get disseminated to the public. The intent and the objective of building this facility at this location is for families with children. Okay, that's which, as we saw earlier, right now it's 25% of the population is families that are being displaced. So it's like, that's huge.
Yeah, and I mean, think whatever you want about people who are homeless and the adults, but how can we blame the children? Like, we have to provide we have to provide opportunities for the next generation if we're ever going to dig ourselves out of this as a society. You know?
I mean, exactly. I want to ask a question here that is maybe a sensitive question, but I know that people that I've talked to, this comes up, and that is when we look at the population. Is there what percentage of the population, I guess the term is chronically homeless? They're not necessarily, they just leave me alone, don't bother me, I'm going to live my life this way. Is that, what percentage of the population is that way?
It's, first, just make a quick distinction. Chronically homeless means folks who have experienced homelessness for longer than a year. So it's been and they have a disabling condition. So they likely need some long-term support to be able to stay housed.
Okay.
Not necessarily that they don't want to receive assistance or they don't want to be housed. More of just a condition of they're chronically homeless, so they're probably going to need some longer-term help. Okay. When we look at the population experiencing homelessness, one of the things that when we survey people who are unhoused during our point-in-time count, we ask if housing were available, would you accept it? And every time we ask, over 85% to 90% say, yes, I would accept it today. It's simply a lack of resources, not a lack of readiness, this misperception that people are choosing to be homeless. Or want to stay homeless, that is not reflective of the vast majority of people. We just don't have enough resources to help those and help those who need it. And we see that in that we have we assess everybody using the same housing assessment so that it's fair and equitable as it can be. We prioritize the most vulnerable households for our permanent housing programs. We also have some shorter-term assistance and have a system for that. But we have to have that system because there's a gap between the need and how much we have.
How much you can, and the solution.
But the vast majority are assessed, they're ready, they want to be housed. We aren't able to meet the need, and some of them need that additional assistance and not able to resolve it on their own.
I think part of the challenge from the public at large is that they are not looking at those individuals out there as people. It's those homeless, right? You know what I mean? And I've been in a situation where I was, if I didn't make rent the next month, I wasn't sure what I was going to do. Okay, I've been there. Okay, You were mentioning during the break that you live in Vegas for a period of time, and you had a situation where you didn't have a place to live for a while. So this is not the sort of thing that it's just those people out there. It's your next door neighbor. It's the guy you work with. It's the person that takes care of you every time you go into to Denny's to get breakfast, and you strike up a conversation. Those are the people who are impacted by this. You have to humanize the problem. So when we think about that, what are the things that need to be looked at from a governmental perspective, federal, state, local, business perspective, individual perspective? We got about 12 minutes left in the show. So what can we let's talk about where the solutions have to come from.
You want me to start?
You seem to be ready for it.
I think the solutions have to come from every level. So let's start at the federal level. We know that the number of housing vouchers, for example, and the public housing resources aren't nearly meeting the need. Neither is our social safety net. Those are being threatened to be cut every day. We see impacts that when we are able to increase resources, provide assistance directly to the people, things that we know are very effective, like the SNAP program in helping people stabilize and feed their family. Those are constantly under attack. So I think at the federal level, we need those ongoing resources that are helping low-income people stay housed and remain stably housed.
In addressing that, do the people write their congressman, their senator, and are there bills going on in Congress and in the Senate right now that are relevant to this that people should communicate about?
I mean, every time there is a budget discussion, it's relevant because for example, Housing and Urban Development, Department of HUD is the one that is responsible for our public housing vouchers as well as much of our homeless programs here, and that funding is almost always under threat of getting cut every year, when really we know it's still just meeting a fraction of the need. We likely need more. So during the budget discussions that are happening currently, it's timely to share your priorities, but it's not just the federal level, the state and local level. We have been fortunate that in California there's been a shift, I think, over the last few years to focus some more attention on housing and the homelessness crisis, and that has been beneficial in bringing some state dollars to help us with these resources. There's also state policies that help make affordable housing development more streamlined. And at the local level, of course, we're making decisions. The local elected officials are making decisions regularly that are either about resources or priorities for programs.
Got it. Cool. One of the things that we had mentioned briefly, I think, at one point here was the positive impact on having a place to live has both physical health and mental health implications, because you're not under this enormous stress on a moment-by-moment basis that can cause someone to just crack. You just go, the pressure is too much. Or the physical implications of having to live in an environment where you're not getting nutritional food and you're in an exposed situation to the weather constantly and stuff like that. So the health implications, physical health, mental health implications are huge. And I got to believe that has an impact on just the social services that we have to pay for, because, so do we have any numbers that we can put on that?
I mean, yes. Homelessness costs a lot of money. It costs a lot of money to our country and Santa Clara County. We collectively conducted a study that looked at all of the data from 2007 to 2012 for our unhoused population, and we're able to determine that Homelessness. So this is a little bit dated, but we would say that it just is more now.
There's been inflation.
Yeah, inflation. It costs over $500 million a year to Santa Clara County alone.
$500 million a year.
Yeah, so that's
in
police.
services that are provided by the county that are not being addressed by the normal tax dollars that you might expect would come in to support the the fire and the police and
they're
social
incidental,
services.
not intentional. You could say,
Yeah.
right? Like there's just
Yeah.
the fire, the police, the medical, and so fortunately, that was the catalyst for the 2016 Measure A housing bond that Catherine mentioned earlier, which only passed by a tenths of a percent. It required a 2/3 vote. So I think at the local level, who we elect matters. Voting matters, right? Especially at a local level, for housing bonds, but also like in your neighborhood. So, we, as Catherine mentioned, there's 50 sites across the county that are in development just thanks to the Measure A housing bond. Each of those requires, approval processes and land use changes, and votes that come up at city council and approval of site plans and making sure that we have all the supportive services in place. So to your point, there's going to be people who move into these apartment complexes who do want to access mental health services, addiction services, healthcare, for example. And just like we see on a national level, right? We know that mental health services, for example, as a nation, we're struggling with that.
Yeah.
So that's trickling to our homeless population as well. So as far as access and how much is available and can people access it when they need it. So, the next time that an affordable housing complex for people, who are homeless, formerly homeless, comes into your neighborhood, we do hope that you'll, come to our website, learn the facts, as you mentioned earlier, like who's going to live there, what kind of services are going to be available, what kind of amenities are in the budget that are going to actually enhance the neighborhood. We're often building trails or parks or building a building that is very intentionally trying to fit into the neighborhood, for example, and it's going to offer amenities and, frankly, affordable housing for people in the neighborhood that doesn't exist.
Yeah.
Yeah, I would just add, I think, in addition to, and this study was one of the most comprehensive, done, and still, I think to this day is probably one of the most comprehensive cost studies. But there, in addition to the direct costs on our healthcare system and other things, there's also just the human cost. I mean, that isn't measurable in dollars today of young kids experiencing homelessness as a child and the potential long-term harm that might do, of youth aging out of foster care system and not having the resources. Those impacts are huge and these are our neighbors, these are family members. They could be any one of us. I think what we see and hear from folks is a lost job, and when they're paying a lost job, a car accident, something came up and they're paying 80% of their income in rent, and that happens. We may have the fortunate circumstance of having savings or a family that can help us out, but not everybody has that.
Everybody has that.
Yeah.
So we got less than 5 minutes left. The two quick things that I want to kind of bundle together and have us address. One is how does the population, how do people in the various communities become aware of discussions at their local level, right, city officer, city leader level, about initiatives, whether it's like the facility that was going to be built, or we're going to pass a measure to outlaw having RVs and on the street, stuff like that. So that's one. And the other one is I want to talk about what people should do about this upcoming vote in the San Jose City Council, which is on the 16th of June. So what do people need? What should people do? I got to believe that most people, if they understand what's going on, would look at the situation and say, something positive can be done. How can I contribute to the positive motion? So what can they do?
So we have a website called housingready.org. and it's kind of the gateway for what we call housing ready communities. And this is a collaborative effort. We work with the county, we work with the cities, we work with the developers, essentially to do exactly what you say, like equip people with accurate information, presentations. We have action alerts when things are coming up, right, in your neighborhood. We have a whole database of people, and we go by zip code, and it's like, oh, we're going to have an activity in San Jose coming up. We want to notify everyone. We want to make sure you have all the accurate information so that you can then turn around and tell your neighbor about it. Because what we see overwhelmingly is that the opposition turns out in force, and oftentimes nobody feels empowered enough to show up in favor of the housing, even though, to your point, we believe and we know that the majority of people, if have the right information and know when the meeting is and how to go to the meeting, will show up. And they want, we want neighbors, and they want to see less people on the street.
What's that website again? I didn't have that before,
Yeah,
so I didn't have a slide for it. What is it?
Housingready.org.
Housingready.org.
Yeah.
Okay.
And we have a map of all of the developments and kind of what stage they're in and how you can get involved. You can sign up for, as I mentioned, what's called action alerts.
Yeah.
So that if something is happening in your interest area and you can indicate what you're interested in, you'll
know.
find out about it.
Okay. So, Catherine, you get the last word here. We've got a little over a minute left, and then we've got to sign off.
Well, that's too bad. This has been fun. I would say, the other thing, this is a complex issue. It's not simple. Housing may sound simple, but I think understanding the causes and the experiences and the solutions. So I think, taking the information that you have, talking with your neighbors about it, talking with your family about it, because that education, you're right, once people know kind of what's going on and that this is, one, it's solvable. Two, we know the needs, we know the causes. We need to share that information and have a more broad understanding so that we as a community can come together and find the right solutions.
Yeah, fantastic. Well, this has been enlightening for me. Thank you both for being here and doing this. And I hope, ladies and gentlemen that are watching this, that you're learning more and that you will take some initiative on the positive direction to help with the solving of the problem. Give us the name of that website again, Chad.
Housingready.org.
Housingready.org. Okay, great. And any other questions that you have, send them in to info@referencepointtv.com. We'll get them to the right people to get the questions answered. So, Catherine, Chad, thank you so much for being here at Reference Point. Ladies and gentlemen, we'll see you next time, and don't forget to do something about this problem.
Thank you.